Welcome, everyone. I'm so happy you're joining me for this very important topic about combating IBS. Because if you can fix the gut, you can reverse and even prevent many of the chronic health challenges we face today. I believe the gut is the gateway to many chronic illnesses like allergies, food intolerances, autoimmune disease, irritable bowel, SIBO, and many more. But first, a brief introduction. I'm Teresa Rispoli, Doctor of Clinical Nutrition, acupuncturist, board-certified functional nutritionist, and founder of FunctionalNutritionistAcademy.com, where I teach a functional nutrition certification program called Mastering Functional Nutrition. And I'm also the founder of Complete Health Institute, located in Agoura, California, where I've been in a successful practice for over 27 years. I'm passionate about what I do, and I decided to pay it forward and help you learn the tools and principles of functional medicine and functional nutrition, which I use in my wellness center every day to solve my patients' chronic health conditions with natural solutions. I want you to understand the importance of fixing the gut. So get a pad and a pen because you'll want to take notes. I'm offering you a lot of usable information here. Also, if you stay till the end, I'm offering you a very special free gift that will help you further understand how to solve chronic health conditions naturally, especially irritable bowel syndrome. So what is IBS? Well, irritable bowel syndrome, often referred to as IBS, is a chronic gastrointestinal disorder. It's characterized by a host of different digestive dysfunctions and discomforts, such as frequent abdominal pain, gas, bloating, indigestion, and constipation. The symptoms and level of severity vary greatly between individuals, but this digestive disorder can be quite disabling. For some, IBS may mean mapping their day around public restrooms, limiting their social life to avoiding unfamiliar places, and rejecting travel plans due to behavior of their large intestines. Anxiety and depression are also often associated with dealing with IBS due to this illness having the ability to negatively affect one's emotional, social, and professional life. Doctors define IBS as a functional gastrointestinal disorder because although the GI tract isn't functioning properly, there's no apparent physical damage. This attitude can encourage a lack of initiative in further research, searching for a cure, and questioning the cause of the dysfunction. Instead, most professionals are trained to medicate to alleviate symptoms. But unfortunately, this does not solve the long-term health problem. Whereas functional medicine doctors work to discover the why behind the disease. As IBS is a collection of different symptoms specific to the individual, the root cause will also likely not be the same for everyone. Ignoring the diversity in this disorder is dangerous because leaving the underlying cause untreated can escalate to more serious conditions such as autoimmune disorders. Functional medicine is revolutionizing healthcare by empowering patients to better understand imbalances in their own bodies, how these imbalances affect their health, and the natural solutions available to support the normal healing mechanisms within their own body. It uses conventional medicine practices for acute care while incorporating complementary health approaches for prevention and treatment of chronic issues. Functional medicine differs from other medical models used today due to its defining principles of personalized care specific to the individual, focus on the cause of discomfort rather than simply the symptoms, and a deep-seated trust in the patient's body to self-regulate and heal. Well, IBS is one of the most underdiagnosed conditions in the United States. In fact, studies have shown that the prevalence of this disease ranges anywhere from 10 to 25% of adults. It's unclear to the accuracy of these figures, however, due to the stigma and ignorance around an IBS diagnosis. Some obstacles include people not consulting with a physician, patients being written off as experiencing psychosomatic symptoms, and the attitude that digestive discomfort is normal. Regardless, irritable bowel syndrome is the most common functional digestive disorder. Some reports estimate between 38 to 96 million Americans suffer from IBS in their lifetime, yet only 5 to 7% of them receive a proper diagnosis and treatment. IBS is a difficult diagnosis because it's diagnosed through the process of exclusion. In other words, extensive lab testing, diagnostic experimentations, and procedures are performed and recorded. If everything comes back normal and the doctors are unable to accurately identify a diagnosable condition, the patient's categorized under the IBS umbrella due to IBS's lack of apparent anatomical or structural problem, physical or chemical disorder. This is ridiculous. This process strengthens conventional medicine's method of symptom management versus uncovering the true root cause of the dysfunction. Some of the diagnostic tests used to identify IBS include medical history taking, physical exam, comprehensive blood test, stool analysis, sedimentation rate, upper endoscopy, IgG antibody testing, and breath bacterial test. Common causes of IBS. Well, just like everyone's experience with IBS is highly individualized, so are the initial causes of the onset of the disease. Although IBS is not formally classified as an autoimmune disease, it shares many of the same risk factors, potential causes, and complications of the inflammatory conditions we know today. Some include poor diet, leaky gut, bacterial overgrowth, yeast overgrowth, parasites, food intolerances, antibiotic use, toxin exposure, chronic infections, stress and psychological issues, hormonal issues, and genetics. So up next, I'll be discussing some of these causes in great detail. Let's look at leaky gut. The gastrointestinal tract is a naturally permeable barrier and serves as a barrier to prevent substances from entering the bloodstream, such as undigested food particles, microbes, parasites, and toxins, and it's a site for absorption of nutrients. So the small intestines is where we should absorb our nutrients. Most of the most vital and basic duties of these cells that line the intestinal wall is to regulate this intestinal permeability. However, when these cells become damaged, they begin to break apart and in turn allow particles to travel throughout the body. Particles such as undigested foods and large protein particles, microbes, toxins, and things that shouldn't be going into the blood. As this happens, the immune system attacks these substances as they're seen as invaders or pathogens. And this results in inflammation and what is known as leaky gut. So this whole cycle causes food intolerances, infections, and due to stress and age-related factors that affects the gut's permeability and integrity. The best way to address leaky gut syndrome is to participate in functional medicine's 4R program, and I'll be discussing this healing tactic in detail a little bit later during this presentation. So now I want to talk about SIBO, which is small intestines bacterial overgrowth. Studies have reported that approximately 80% of people with IBS also suffer from SIBO. This occurs when there are imbalances in gut bacteria, resulting in an overgrowth of bacteria in the small intestines. There should be no bacteria in the small intestines whatsoever. This condition is often fueled by a diet heavy in sugar, alcohol, and refined carbohydrates because many of the strains of bacteria indicative to SIBO feed off these anti-nutrients. The use of antibiotics, acid-blocking drugs, and steroids can also disrupt the gut flora, creating an attractive environment for bacterial overgrowth. SIBO can be diagnosed by a breath test. This test provides information on the bacterial activity and the best treatment protocol that would be most effective specifically for you. So the treatment for SIBO also includes the 4R program, dietary changes, and if need be, a prescription of rifaximin. Yeast overgrowth is very similar to SIBO in the sense that it causes many of the IBS symptoms such as bloating, gas, constipation, and diarrhea. Instead of bacteria, it's a yeast or fungi that has overgrown in response to an imbalance in the gut flora. The most common form of yeast overgrowth is Candida. This is a type of fungus that's naturally present in our mouths and intestines to aid in digestion and nutrient absorption. However, in excess, Candida contributes to the breaking down of the intestinal wall that is a common characteristic of leaky gut complications. And this fungus is also highly inflammatory, and it can lead to a variety of health problems, specifically IBS symptoms. Candida feeds on sugar and carbohydrates, which puts most of the American population at risk due to the incredible increase of sugar and carbs in our food supply. Yeast levels can be tested by blood, stool, and urine testing. I prefer the stool method. Now, parasites are much more common than most people consider, especially here in America. Contrary to popular belief, you do not need to travel to high-risk areas to be exposed to them. In fact, it's not difficult to contact a parasite by the imported food at the local grocery store or eating sushi, which is raw fish. Since they are usually ingested, the most common issue they contribute to is digestive damage and compromise nutrient absorption. Unfortunately, healthy bacteria in the gut is not strong enough to defend against the parasite's rate of reproduction. Long story short, parasites can be directly harmful and often need additional care to eradicate their presence and potential damage. Then there's food intolerances, allergies, and sensitivities, which can all contribute to significant digestive distress, much like those associated with IBS. They can be very hard to detect for a number of reasons, including you could be suffering from more than one. Elimination testing takes a significant amount of time, and not everyone reacts to the same food sensitivities. Symptoms of food intolerance can easily be misinterpreted. Luckily, there are several ways to test if you're suffering from food allergy or intolerances. So up next, I'll be diving into these details on a couple of them. Immunoglobulin G, or IgG, is the most abundant antibody in the human body. It's found in all of the body's fluids and works as a protection mechanism against bacterial and viral infections. Testing the levels of these antibodies in the blood can be an incredible tool to indicate adverse food reactions. However, these methods of testing may not be available to everyone, which is why we otherwise recommend a comprehensive elimination diet. And most doctors, when testing for allergies, only test IgE, which is an immediate reaction, when most food sensitivities or intolerances are IgG or IgA. So what is an elimination diet? This diet refers to the process of eliminating foods that may be sabotaging your health and experiment how they make you feel. The elimination diet takes approximately 3 weeks in order to allow for any adverse reactions to dissipate. Essentially, the goal is to bring your body back to a blank state diet-wise, so you can begin to reintroduce each food group individually. So the idea is to give your gut a break, let it heal, and then reintroduce each food group. This gives you the opportunity to really recognize how each food makes you feel. The common food offenders as far as IBS, food intolerance, and digestive distress include, at the top, dairy, gluten, soy, corn, eggs, refined sugar, peanuts, red meat, alcohol, caffeine, hydrogenated oils, and packaged or processed foods. But don't worry, there are plenty of foods that you can eat during the 3 weeks of elimination. And here's those elimination diet-friendly foods. Unless advised otherwise, the following foods are safe and encouraged to consume during the elimination diet. So gluten-free grains like rice, quinoa, amaranth, tapioca, buckwheat, or teff. Dairy substitutes like almond milk, coconut milk, hemp milk, or rice milk. All vegetables except corn, whole fruits, whether they be fresh, frozen, or water-packed. Lean and clean animal protein, wild game, lamb, organic chicken, fresh fish, nuts and seeds. Beans and most legumes, except soybeans and peanuts. high-quality oils like coconut, avocado, and cold-pressed olive oil, herbal teas, and sweetener alternatives in moderation, honey, blackstrap molasses, or brown rice syrup, and spices, as long as they don't irritate you. So let's go over some do's and don'ts. During the reintroduction phase, it's incredibly important to pay attention to how each food makes you feel. This is done by reintroducing food groups one by one for 48 hours at a time. You would pick one food to introduce into your diet again and take note of how it makes you feel for the next 2 days. Try the same process again for an additional 2 days. If you did not notice any issue for those 4 days, you can choose to reincorporate that food into your regular diet. Continue following these steps with the remaining eliminated foods. If any seem to cause any discomfort, stop eating them and wait until any symptoms subside before continuing the process. Note that it's imperative to allow the adequate amount of time for both the elimination and reintroduction phases to ensure you receive the most accurate results possible, and allow time for your gut to heal. Now, as promised, here's a highlight on the functional medicine approach. It's called the 4Rs. The 4R program is administered to heal from digestive stress, reverse gut complications, and rebalance your gastrointestinal microbiome. It's an incredible tool to acknowledge and treat health issues, dysfunctions, imbalances, and personal health needs. It needs to be done in the following order, however. So the first is remove. You want to eliminate problem foods, toxins, low-grade infections, and oxidative stress. Then you want to repair. Begin reintroducing a clean diet with essential nutrients for your body. Then you want to restore. You want to repopulate your gut with healthy bacteria to restore the proper balance of gut flora. And finally, you want to replace things like digestive enzymes, antioxidants, immune-boosting vitamins to promote a sustainable and healthy digestion. So probiotics are live bacteria that promote healthy balance of bacteria throughout the digestive tract. They can be naturally found in foods such as yogurt, kefir, sauerkraut, tempeh, miso, and kimchi. Prebiotics are a type of plant fiber and act as fertilizer or food for the probiotic bacteria. In short, prebiotics are needed for probiotics to thrive within our digestive system. Prebiotics are found in foods such as artichokes, garlic, onion, asparagus, apple, legumes, and fibrous plants. Digestive enzymes are important as well because they assist in the breakdown of food and aid in nutrient absorption. So if you break the food down, the altered or bad bacteria in the gut have nothing to grow on. According to a study published in 1999, taking digestive enzymes after a high-fat meal reduced many of the discomforts people with IBS experience, such as gas, bloating, and uncomfortable fullness. Another study done in 2011 studied IBS patients' reaction to digestive enzymes compared to a placebo group. Those taking digestive enzymes demonstrated a significant decrease in symptoms, including gas, bloating, and abdominal pain. So there are other important nutrients that I suggest for those suffering with irritable bowel syndrome or any other gut issue. Fiber is extremely important because it helps absorb toxins and helps move digested food through your bowel. Vitamin B is important for stress and a lot of other things. Omega-3 fatty acids, they reduce inflammation. Magnesium because it calms. Calcium, vitamin E, and one at the top of the list is glutathione. It helps heal the gut wall, reduces inflammation. Melatonin because it helps you sleep properly. Without sleep, you can't heal. And peppermint oil. Peppermint oil is very soothing to the gut. Of course, everyone's needs are different, so it's very important to get to the proper nutritional testing and follow your doctor's recommendations for your individual supplemental needs. So let's talk about the importance of detoxification in healing the gut. Exposure to toxins we experience on a regular basis can build up in our systems, weaken our immune and digestive functions, and truly deplete our body's ability to heal. Different forms of toxic exposure include pesticides on food, air pollution, and water contamination and toxic chemicals in household products. Here's some ways to practice prevention and detoxification. Well, proper nutrition is one of them, eating whole foods, not packaged. Hydration, drinking enough water. Water filters, they filter out most of the toxic chemicals and medicines. Air purifications. Exercising and sweating. And toxin-free personal items. Last but certainly not least, the importance of stress relief on the gut. Managing stress is one of the most single-handedly important things you can manage to support, optimize, and sustain good health, period. Studies have supported that a higher stress level increases the rate of IBS complications. It aggravates symptoms, lengthens the time of episodes, and decreases the rate of repair of digestive damage. As the gut and central nervous system are closely related, it's incredibly important to find stress management techniques that work well for you. Some examples follow. Deep breathing exercises. Exercise, period. Yoga, massage, meditation, creating art, spending time with loved ones, going outdoors and experiencing and connecting with nature, aromatherapy, and many, many more. How do you best manage your stress? Why don't you try a few of the above? So thank you for taking the time to experience combating IBS. I'm passionate about sharing this topic with people who are eager to transform their lives and finally achieve optimal health. If you have any further questions, please contact me at support@functionalnutritionistacademy.com. I'm here to support you. Well, that's it for today. Thank you again for taking the time to experience the class, and give yourself a pat on the back for taking steps to improve your health. I'm passionate about sharing this topic with people who are eager to transform their lives and finally achieve a healthy, happy gut. For a deeper understanding of how the gut functions and sustainable ways to improve gut health, or more information, and your free gift, don't forget your free gift, you want to visit functionalnutritionistacademy.com. Subscribe to the free report for your free gift, and it's here that you can also learn how to become a board-certified functional nutritionist online in your own time. Or you can take the 4-hour Mastering Gut Health program to get a deeper understanding of how to heal your gut. I urge you to join now and become a leader in your area. We need more people like you. If you'd like to book an appointment with myself, Dr. Rispoli, you can visit CompleteHealthInstitute.com and you can book your appointment online. So I hope to see you in class. Bye now.